Preventative care is important with all ages, but this is especially true with the older adult. Hello again, this is Angie Ottercrans, BSN student at Indiana State University. I'm continuing my video series on older adult that aligns with the Healthy People 2020 goal of increasing function, health, and well-being of the older adult. Today we're going to talk about preventative care and why it is so important for the older adult. So let's start. Prevention, the main intervention. Here we go. So let us start with some learning objectives. I hope that those who watch this video learn to understand the reason that preventative care is so important for the older adult. I hope that they are able to recognize what type of preventative care an older adult should require. We're going to break down care needs for the older adult by male and female, and to also give options as to where the older adult can obtain preventative care. So before we start, let's go ahead and see where our knowledge is already. Let's go ahead and pause this video to take the pretest. You can take the pretest by clicking the link in the description below. Remember that there are the answers at the right-hand bottom corner of the screen so that you can check them. Good luck! All right, so how'd you do? Did you get most of them correct? Great job. Would you like to do better? No problem. Let's dive right in and find out why preventive care is so important for the older adult. Let's first speak to what the older adult is that we're referring to. An older adult for this presentation is considered 50 years old or older. So let's look at why the preventative health care is important for older adults. Preventative health care can recognize problems before they become serious and keeps older adults healthy. According to Abraham, 7 out of 10 deaths are from preventable diseases. Now, preventative care is different in each older adult, as each older adult has different medical conditions, genetics, and environments. So when we talk about preventative care for the older adult, there are 4 interventions that are the foundation for all of the interventions of maintaining health in the older adult. Let's take a look at those. The first one is exercise, physical activity. You can see my other video on improving physical activity in the older adults and why it is so important. Next one is a healthy diet. A varied diet that includes many nutrients is recommended for the older adult. Another one is cessation of use of tobacco and excess alcohol. And the last one is mental well-being. So, what kind of preventative care is needed by the older adult besides the ones we just spoke about? They need screening tests to test for different health problems that can arise as they age. They can have medication reviews to help in making sure that medications are not interacting with each other. And there are immunizations that are needed for the older adult to keep them healthy. Now, the preventive care, as we had said, needs to be individualized based on the older adult's functional status and the presence of disease processes. Tazkarji, Lam, Lee, and Mayapin report that primary care physicians can use a quick acronym, CCFP to help guide the preventative care screenings for the older adult. This acronym stands for Cancer, Cardiovascular, Falls and Osteoporosis, and Preventative Immunizations. For this presentation, we are going to focus on 4 areas of preventative care for the older adult. The first one is going to be the immunizations that are required to keep older adults healthy. Next, we're going to talk about health screenings that are required for both the older adult female and male. And then we'll break it down into the specific health screenings that are required for an older adult male and for an older adult female. All right, now that we've covered the recommended immunizations for the older adult, let's look at the recommended screenings for both the older adult male and female. Tashkari recommends the tests below for the older adult: cholesterol testing, hemoglobin A1C, blood pressure, heart rate and rhythm, colorectal screenings, bone mineral density test. And Abraham also speaks to vision and eye exams for the older adult to ensure that there is not a significant decline in vision and other concerns such as glaucoma. Other recommended screenings are skin checks to make sure there's not cancer developing on the skin, cognitive impairment and mental well-being checks, screenings such as your screening for depression, anxiety, and your cognitive screenings, and also for functional testing, such as how well the older adult is functioning overall. All right, so now that we've looked at some screenings that are for both the male and the female, let's concentrate on the older adult female screenings. The CDC has a great file, PDF file that you can access that talks about the recommendations of top agencies on cervical and ovarian cancer screenings, so your pelvic exam, your pap smears. They say that, definitely women over the age of 65 years old should have both of those routinely, at least for 20 years. There is some discussion on how often those should be done. There was documentation in regards to every 2 years to every 5 years, and then when to stop those screenings depends on a conversation between the woman, her initial factors that she brings into it with her health, her history, and the physician. The breast cancer screenings, breast exams and mammography should be provided to women age 50 to 74 years old. There is talk about after 75, the benefit versus the risk of having those screenings. And this will be an individualized conversation between the woman and her physician on stopping these screenings. All right, so now let's move on for the preventative care of the older adult male. The American Cancer Society recommends the average risk adult males should have a PSA test, or a prostate-specific antigen test, and a rectal exam of the prostate starting at age 50 and for every 2 years after that. This is individualized, of course, with past history and risk factors. Hoffman recommends continued screening until the age of 70 to 75. The reason why: PSA levels normally rise with age, and this then becomes a discussion on, is it age-related or is there a possible prostate concern? The other thing that I found interesting when researching is specifically the U.S. Preventive Service Task Force reports that men 65 years and older should have at least a one-time screening of an abdominal aortic aneurysm screening. This is an ultrasound screening where they can look at the flow of the arteries in the abdomen. Apparently there's a greater prevalence of AAA, or abdominal aortic aneurysm, in males and females, so they do recommend this for older adult males. So now one might ask, how does the older adult access the preventative care? There may be some barriers in regards to this. The older adult may not have the financial ability to be able to access some of the preventative care. There may be transportation issues where they're not driving a car and need to be able to get to a place where preventative care can be given. There may also be some cognitive things that come into play with getting that preventative care. Some of the places that the older adult can obtain preventative care is primary care physician's office, that's the primary one, but also community health clinics, community health drives like the 9 Health Fair. That's an example here in Colorado. Community health events at community centers. Programs such as Screen Out Cancer provided by the CDC that offers Pap and mammograms to underserved women. The immunization flu clinics and senior centers. Senior centers are a great resource to for an adult to look and start to find preventative care options. All right, now that we have explored some information in regards to preventative care and the importance of it to the older adult, let's go ahead and take a post-test. Remember, go ahead and pause the video to take the post-test. You can copy the link below in the description to be able to access the post-test. And remember that there are answers at the bottom right hand of the screen so that you can check your answers. All right, so how did you do? Hopefully you did better or about the same of what you did on your pre-test. Great job. So remember, prevention is the main intervention for healthy older adults. For more information on preventive care services, you can go to the websites below. Centers for Disease Control and Prevention has a great older adult area in regards to their healthcare, and also the National Council on Aging. Also, community senior centers are a great place to look for access options for the preventative care. Thank you for watching this video, and hopefully you remember that prevention is the main intervention.